Hi, my name is Carrie Dunbar, and I was going to tell you a little bit about the preliminary results from a study that we've been doing using confocal laser endomicroscopy to look at patients with gastroesophageal reflux disease. So in our study, we're trying to determine if there are specific endomicroscopic changes that we can see that correlate with acid reflux in patients. So we use the confocal laser endomicroscopy system made by Pentax, which is a built-in, looks like a regular endoscope and has a very small microscope in the tip of the endoscope. We can obtain microscopic images of the lining of the gastrointestinal tract by placing the end of the endoscope directly on the mucosa. The images we get are magnified about 1,000 times normal, which allows us to see individual cells, small blood vessels, and capillaries. So in this particular study, we were enrolling patients who have GERD symptoms. All patients filled out a validated GERD questionnaire, underwent endomicroscopy with the aid of fluorescein sodium, and had a wireless pH capsule placed in their esophagus for a 48-hour recording of their acid reflux. These are some of the proposed features of seen on endomicroscopy that may be related to gastroesophageal reflux disease. One of the things that we suspect is related to GERD are increased intrapapillary capillary loops. These are actually individual capillaries in the mucosa, and we think that in patients who have more than a certain cutoff of these, so more than 4 or 5 per screen, that's associated with GERD. We can also see dilation of the space in between individual cells, called dilated intercellular spaces. Sometimes the fluorescein, which is the contrast we use for endomicroscopy, will leak out onto the surface of the esophageal mucosa. We think this is also associated with GERD. And then also occasionally we'll see a glow or a halo around the intrapapillary capillary loops that we think is related to acid reflux. This is just a regular mucosal biopsy stained with hematoxylin and eosin, and you can actually see this is a patient with GERD, and they also have dilated intracellular spaces. So a lot of these proposed features are actually things out of the pathology literature. So our study right now is very small. We've enrolled about 13 patients, and all the patients have completed their wireless pH capsule testing. For patients we've compared the endomicroscopic features in the distal esophagus and then in the mid and proximal esophagus. And for now, the features that seem to be suggestive of possible acid reflux, confirmed by wireless pH testing, include having more than 4 intrapapillary capillary loops per high power field or per endomicroscopy field in the mid and upper esophagus. And also that the intrapapillary capillary loops are closer to the surface, suggesting ongoing inflammation. In patients who do not have documented acid reflux, the intrapapillary capillary loops seem to be much lower underneath the surface of the squamous mucosa. So it seems we're still enrolling patients and hope to have more data collected soon for some additional analysis and to see if there's a gradient effect in the esophagus.